just join in. Hi, everyone. My name is Dawn Evans Casey. I am the leader of Collaborating Connections, and I want to welcome each and everyone here this week on our Tuesday night professional networking Zoom call. Collaborating Connections has been around for the past 5 years or more, and we are part of the TTR Networking umbrella, which is one of about 14 groups. Some meet in person, some meet via Zoom, like we do. Collaborating Connections is the only group that meets in the evening time. And that's because we've got quite a few of our members that have a daytime job, a 9 to 5, and an entrepreneurial endeavor that they cultivate in their off hours. So whether you're available during the day or available in the evening, or what day of the week works best for you, TTR Networking surely has a group that can accommodate. We were just talking before COVID, we used to meet in person, but since COVID, we've gone to the Zoom format, which I really enjoy because it gives us the opportunity to meet wonderful professionals from coast to coast, all over the United States and around the world. We've had the opportunity to engage with professionals from Canada and the UK and the Netherlands, and we invite anybody. If you are in a business, an industry where you can do business with anybody, not geographically limited, we would love to meet you and find out more about you and your business. So, Collaborating Connections, we exist to cultivate relationships, provide business referrals, talk through some professional development topics. On a monthly basis, we have themes that guide our conversations. And for the month of December, our theme is digging into the details. So it's a perfect time of year as we are wrapping up our calendar year to look back on our progress and productivity of our business. Think about those metrics, that those goals that we had at the very beginning of the year, and look at the details of our progress. What have we achieved? What do we still have yet to achieve? And how best to review and manage that and make sure that we get to success. I'd also like to share to the rescue. The rescue acronym actually stands for quite a few buzzwords that are very important to the TTR networking realm. The R stands for relationships. The E is for education. The S is for success strategies. Our C is for community. The U is for understanding, and the second E is for execution. So, for all that we do, for all that we talk about and share, it would mean nothing if we didn't get out and just go do it. So, that execution is so very important. And we love to chat and support each other in our endeavors and take the opportunity to find out what makes an excellent referral for you and your business. So I want to invite everybody to go ahead and go into the chat room, include your name, your business name, whatever relevant contact information you have, whether that's a phone number, email address, website, and we're going to make sure to share those details along with the recording of our weekly meeting is routinely posted out on YouTube, and we also share it on our Collaborating Connections Facebook page. So those who aren't able to actually be live and be a part of this meeting with us still have the opportunity to meet and learn about us through the recording, perhaps become familiar with how our meetings are managed, what we talk about, and we look forward to perhaps them joining, visiting with us in the near future. On a weekly basis, what we really like to do is to kind of touch base on what new and wonderful is happening, celebrate any wins that have occurred. And with that in mind, I want to kind of open the floor and ask anybody, do you have any wins or any celebrations that you would like to share with the group this week?
Well, I think,
So-
Nancy, go ahead.
Okay, so I have chased a client down. I believe I'm on my second year. And I finally signed him up today for Medicare Advantage.
Woohoo!
2 years, but it's done.
Okay. Congratulations.
So did he do something last year, Nancy, or no?
Yeah, well, he was on Cobra.
Oh, gotcha.
And the $100 question is, Cobra is not it doesn't cover Medicare. It's not a comparable plan. So he might get hit with a penalty.
Oh.
Or at least for his drug plan, because he had B all along, even if he wasn't using it. But yeah, that's it.
Well, that's persistence and just probably just being nice and not closing the door. I mean, you could have said, I'm not gonna waste my time, but look, you got him.
There you go.
And as long as you're sharing, as long as he knows the stuff about, he understands there could be penalties. Does he get that?
Yeah, he's been dealing with them all along, different penalties, different directions. So
That's too bad.
And
Okay.
and he's been paying $2,000 for his Cobra a month.
Wow. Oh my goodness. That's
Yeah.
a lot.
Yeah.
That's too bad. But
Well,
now he's got you.
We often talk about, the follow-up, and that it often takes more than one or a couple touches in that follow-up to get to success. So I'm really happy that you stuck with them and were
Yeah.
able to help them, Nancy. That's
For
great.
sure. For
Thank
sure. You're welcome. And I will shout out to Nancy too. I last week my daughter was panicking a little bit because she changed jobs a couple months ago, but now she's finally dealing with the insurance and everything. And after our call last week, I called Nancy up about a half hour later and apologized for, I think it was about a half hour. It might have been earlier. It might have been, I don't know. But I had some questions and I thought I knew the answers, but Nancy actually clarified some of that. And unfortunately for Nancy, it didn't turn into necessarily a piece of business, but I knew that I could believe that whatever she knew and shared, I could trust her to share. I knew I could trust her is what I'm saying. So she gave me good information and I was able to pass that along. And my daughter that I thought was possibly going to jump off a ledge was not. I'm joking, but she gets a little panicked and she doesn't, and they're young, they don't understand. But this is not like unique to them. It's like everybody's, which is kind of funny, not funny, but that we have Dr. Holiday on today, that it's just because I don't think we all understand exactly everything that's out there. But as older adults, I can say, you're not the first people to get this crazy insurance stuff and be overwhelmed with it. I mean, we all have gone through that at some point or another, but Dr. Holiday can actually share with us her whole, the stuff that she does, which is kind of, I mean, I think it's pretty new. But anyway, but I will shout out to Nancy that was wonderful. So thank you for your help with that.
Super awesome.
It was very much so.
And we often talk about, the networking is much more than just getting referrals for business at times, but it gives us a platform and an opportunity to be seen as subject matter experts in
Right.
what we do. So that when you mention that you can trust Nancy's information, what she's sharing with you, you know that she's a trained professional, and building a relationship with her, you know that she knows what she's talking about, and that goes a long way. So it's an important part of the networking process that we're building those trusted relationships and
Right.
setting ourselves out there as subject matter experts in our industries. So wonderful.
For sure. For sure. So thank you, Nancy. I appreciate that.
Okay. Let's spend just a quick moment. Do we have any TTR networking updates that you'd like to share with us, Jennifer?
I did. I want to make sure I'm not okay. Yeah, and unfortunately, I have to jump off on and get on another call. But I know that you will be very blessed by hearing about Dr. Holliday and her practice and what she's doing in the future. And we have next Wednesday already. We have our message of hope, turning adversity into opportunity, which we are posting all over. You know, Dawn, you were on that call last year with Sherry Hammersmith, but this is going to be also featuring our own member, Christy Fulmer. I'm sorry, Christy Rose Fulmer. She goes by her full name. And it's all about these ladies have both experienced suicide in their families. And Sherry happens to be my daughter's mother-in-law, and she's not a member of TTR. But this past year, Christy Rose Fulmer, who is now a member of TTR, is also a retired world champion boxer, female, and she's in the Hall of Fame in Indiana. Was inducted into the Hall of Fame this. I think it was this summer, but they both shared this because Christy has shared with me since she joined us that both her father and her brother both committed suicide. And I don't know how many years ago it was, but the story is that she was so angry and just lashing out and just very unhappy. And her mother gave her a pair of boxing gloves and told her to go take it out in the ring. And she then turned it into this 3-time world champion boxing, which, you're thinking, oh my gosh. But then that's not all she did with it. She actually is one of the co-founders of Rock Steady, which is a program for Parkinson patients. Indiana Parkinson Foundation has this Rock Steady, but it's an international program that Christy is part of. So these two ladies and my daughter's mother-in-law, she created this program called One Step at a Time, which is a program it's a run walk in September, but she's also now partnered up with a bunch of the schools in Ohio to do programs, buddy system programs. But her oldest son had committed suicide a number of years ago before we met them. My daughter is married to their younger son, if that makes sense. So anyway, but this whole presentation is just the idea that, yes, you can, good people have horrible things happen to them like this. But finding a way to move from this adversity into an opportunity I think that's what I don't even know if I could do that. I don't even know, but you will be very blessed, I think, by attending. That is actually on Zoom at 4 o'clock next Wednesday, Eastern time. We're sharing it all over our social media. That is our big event. We do have, that's on Wednesday. We do have an open networking this Friday as well at the Haverstick. And then January will be here before you know it. So we've got our global partner, Robert Bonjour with Offset House Printing has agreed to do a presentation for us, and that will be on January the 12th, and it'll be just right about lunchtime. It'll actually be at 1. But our theme in January is joining. So what are you talking about when you're joining something? Well, we all start to join a health club, or we join, whatever it is in January. That's the time we're all gung-ho about it. But Robert is a young guy, but he has been a part of our network 8 years, I think, 7, 8 years. And they are a printing company. And how they're surviving is that they're thinking outside the box. But I asked him if he would do a presentation just about, he's a member of all kinds of networking things. And I'm going to ask him to just, talk with us about what it means to join something and really become a member of that group, not just a face, in a directory or whatever, but become, he's very into that. So anyway, that's our big thing. Yeah, so January, that's the 12th. And some of our other things we'll start sharing. We have our mastermind and our Ignite program. Those are all going to be launching again after the new year. But right now it's primarily just wanting people to not waste this time of the year when you're meeting people. Don't be shoving your business in their face, except for Nancy, who's got if tomorrow's the end of her annual enrollment. She's got to be shoving it in people's faces. But just use this time to make connections and just remember that you've got to follow up. You've got to stay in front of them. So that's
Awesome.
it. And I appreciate the opportunity. And I am sorry that I'm going to have to jump off, but I'm going to have to jump off. So go ahead.
Okay. All
Yes.
right. All right. Do you have time to do a quick elevator pitch for yourself before you go, or?
Sure. I am Jennifer Johnson. I am the founder of TTR Networking, which is To the Rescue Networking. And we've been around for about I guess we're going to be starting almost our 12th year now. I can say we're past that. And I'm all about connecting people with each other, making those connections, but also to help you connect to your authentic self. I had to come up with a mission, or my mission statement. That was what I do. TTR Networking, we're all about just, building those relationships and keeping you in front of your potential clients. So there's a number of tools, and that's what I help you with. I'm a relationship marketing coach. So who do you know that's out there that needs, or maybe they're struggling because they just can't figure out how to grow their client base while trying to take care of who they're already connected with. It's a big job. Networking is part of that, though. Definitely, seeing people on a regular weekly basis and taking advantage, and I'm saying that in a positive way, but taking advantage of those people and their connections. That's why we're all here. We know that Nancy knows at least probably 500 to 1,000 people. So why wouldn't we, want to connect with each other and get those warm introductions? So who do you know that's out there needs networking? Who do they, I'm happy to chat with them. Hey, Robert's jumping on. That's good.
Yay.
So
All right.
I'm looking forward to Dr. Holiday and everybody getting to know her. So I am sorry, but I'm going to leave, but
Okay. Thank you
please,
so much for being with us, Jennifer.
no worries. You guys have a great time. Great
Thanks.
meeting. Thank you. Bye.
Bye-bye. All righty. Well, I know Robert's getting connected. I want to go ahead and invite our visitor, Rachel Holiday, Dr. Rachel Holiday. Are you ready to introduce yourself and your business?
Yeah.
Okay.
Thank you so much. Yep. So I am Dr. Rachel Holiday. I'm an internist and pediatrician, primary care doctor. And for a little over 2 years, I've had my own direct primary care practice called Indie Direct Docs. So essentially, the way that I explain direct primary care to people is that I am like an out of network doctor, and that no current insurance plan bills for my level of care. Patients pay me a monthly membership fee, and they pay me the same fee every month, regardless of how much they use me. So in a way, I'm like Netflix for your doctor, in that you pay one fee and you pay the same fee every month that you budget in, and you can see me in person. You can text me, you can email me, or talk to me on the phone, and it's all the same amount. So you don't get charged extra per interaction. So another way that I explain it is that I essentially have an ongoing conversation with patients about their health, both chronic care management, preventive medicine, and acute care. And whatever way works best for both of us to do that, whether it be in person or over the phone, is how we do it.
Wow.
I have a question. Do you take seniors too?
I do. Yep. Babies all the way. I currently have a patient who is 76.
So they just get charged one fee for a visit?
Yeah. So for the primary care aspect, regardless of what type of insurance or no insurance you have, you pay the monthly membership fee. And then if you have insurance, you can use it for things like blood work, medications, going to the hospital and seeing specialists. You just can't use it for the monthly membership fee to see and communicate with me.
Okay. But you're literally doing everything, consultations, writing scripts.
Yep. Yep.
Okay.
Yep. And I don't have any staff. So, when patients come, I greet them. They don't have to wait because I schedule it in such a way that I'm not overbooked. I am a micro practice, so I don't have 3,000 patients the way that a large practice would. And because, sometimes you might have an issue, like let's say you get allergies and every year and it's September and your allergies are flaring and they're the same allergies that you've had for years. Rather than call and talk to a phone line who then says, okay, the doctor will see you in a week. And then you go and you wait for an hour to see the doctor for 5 minutes and then they fill your script. You text me and you say, I'm having my allergies. Can you send in my allergy medicine? And I send it in. And so I'm just not as booked as a regular doctor would be. And so I greet patients at the door. We spend time together. Sometimes we spend an hour together. I am the one who takes vital signs. I'm the one who would give you medicines if you need that. I do consults. So like making consults and, scheduling x-rays or whatever it is that you need. I do everything.
Okay. It's a different concept than what folks are used to in the medical field. So is it challenging in getting your clientele used to your processes? And what type of feedback have you gotten from your clients?
Yeah. So it's different than what we think of, current medicine being like. But this is actually more what older medicine was like, where you had more of a relationship with a doctor. And so at first, some people don't quite catch on to the concept. But when patients join, they love it so much. It's so convenient. And also so much more personal than what they're used to, that it doesn't take long to kind of figure out that they just have access to me. They also have access to me after hours for emergent issues, which is really nice, rather than, getting a hold of a triage nurse who doesn't really know what's going on. And then they'll call some other doctor who happens to be on call who isn't your doctor. I find that for me, I used to be part of a big hospital system, and I would get calls about patients who were not my patient, and it would just take me a long time. Whereas when I know a patient and they tell me what's going on, I can very quickly triage them and say, you need to go to the hospital, or I'll see you tomorrow, or I'm going to call in this medicine. I've called in medicines at 8 o'clock at night before. And let's see, how this is going for you by tomorrow.
Okay, great. The monthly fee, can you give us an idea on the affordability of that?
Yep. So I have individual and family plans. For an individual, it's $95 a month. If other family members who live in the same house and do life together join, it's $75 a month for that second family member. And for a third, fourth, or fifth family member, it's $35 a month per person.
Okay.
I guess the question I have, if you don't mind, I'm sorry, it's Robert Hailey. I'm sorry. So you are a throwback from the old day of how you see your doctor. It was just you and your patient. If you and the doctor, then the insurance was the third wheel. Now that right now, insurance is the primary, and the doctor is the third wheel.
Yep.
So
Exactly.
So my question is basically, what hospital are you affiliate yourself with for your patients as a whole?
Yeah, so I am totally independent. I am not affiliated with any hospital. So when it comes to either sending people to the emergency room or sending them to see specialists, I send either who a patient prefers based on what side of town they live on, or there's a particular dermatology group that I really like. There's a neurologist that I really like. There's a particular ER that I'm very fond of. That's where I tend to send people. And so, yeah, it's based on my preference and patient preference. I can send people anywhere.
So since doctors are now affiliated with an insurance company in a network, and if you're not in a network, when you don't, because anytime you want to do something, you got to get referrals. So I'm trying to see how that work for you. I guess someone can't be in a PPO plan. You have to be in a HSA plan, which is basically you don't have a network that you affiliate yourself to. You just have a hospital that you're kind of associating with. So I'm trying to figure out how do you, I guess, recommend to your potential clients, how they can be able to better to use your service without absorbing its costs from the insurance company.
Yeah, so for my fee, for the monthly fee, they can't use their insurance for that. But for blood work or to go see a specialist or to go to the hospital, they can use their insurance for that. And all that is needed from insurance is, even, with a PPO plan, is a referral. So if I refer to somebody who's in network for them, like an endocrinologist or an orthopedic specialist or something, that doctor will bill their insurance. So the idea here is that we're unhooking the day-to-day medical care from the more expensive, rare use care. So we want to try to use our health insurance the way that we use our car insurance, and that you want to have catastrophic coverage for car insurance, but you don't need to do it to rotate your tires or to put gas in your car. Instead, you have price transparency and you have ease of use. And so you're going down the road. I'm so sorry. A patient is calling me. I will get back to them after this meeting. And you can look and see this gas here is 3 cents cheaper, but I don't feel like turning left, so I'm going to turn right instead.
Are you sure you don't want to get that?
I don't. It's like no, I don't want to answer it because I'll leave a message. And sometimes after hours, I also get spam calls, unfortunately. So I'm so sorry. So essentially, like, you can choose. And that's one problem that we're having in healthcare right now, is that it's hard to use. It's hard to use to get antibiotics for a cold. That shouldn't be hard. So it's the idea of like unhooking the day-to-day 90% of the medical care that you'll use from your health insurance.
So if a patient's get hospitalized,
Mhm.
how are you servicing that? How are you going to service if you're not affiliated with any of these hospitals?
Yeah,
How
so
would you be able to the service?
yep. I would call ahead and inform the ER doctor that they're coming. The ER would see them, and if they're sent home, then I would be able to get them in the next day. And I would, know their labs and everything, which I was not able to do when I was in the system. It took a lot longer. If they're in the hospital, then again, I can be on the phone with them when the doctor is coming and rounding on them, and talk doctorese, if you will, talk doctor with the doctor that's seeing him in the hospital to kind of explain a little bit more about how they are on a day to day, and brainstorm with the doctor and just kind of be in the loop.
Yeah, yeah, because I feel you have to be affiliated with a hospital before you know to be able to walk in there to see a patient. So you're not actually physically coming to the hospital. You are actually talking to the doctor that is associated with the hospital.
Yeah, and primary care doctors don't round on patients anymore. So if you were to go to some of the bigger name hospitals, your primary care doctor is not going to be the person taking care of you in the hospital either.
Mhm. Okay.
Yeah.
Gotcha. I mean, your throwback, which is basically what I always tell is, if we ever can turn back the hands of time, uh, you will find that service at the level of the patient doctor really meant something, and the
Mhm.
hospital was just what it is, the insurance, not driving the bus like it is today.
Yep.
But it's a huge. And I think I always tell people, if you can take out the insurance out of this as we know it today, your costs will drop dramatically,
Mhm.
and you'll find that you're not you actually spending time with a patient versus with your doctor versus just being a timestamp.
Yep.
Hey, I got 10 minutes with you. I got to run through all I got to run through, and I scheduled 20 people for the same time slot, and we just he's just running through the room. So,
Yep.
hey, Rachel, I appreciate you.
Yeah. Thank you. Yeah. And I have worked in again a large clinic, and I have been that doctor, and it's very challenging because with insurance, they're reimbursing less and less for primary care. And so you're just having to see more and more patients in order to keep your lights on and to pay your employees, like your nurse and the people who answer the phone. So it's very challenging to try to have a medical practice by being reimbursed by health insurance. That's why you're not really seeing independent primary care clinics anymore. And they're all getting bought up by hospital systems
Yeah.
because they're able to balance the not very lucrative primary care with the surgical specialties.
Gotcha.
So you're a general practitioner, I'm assuming, correct?
For kids and adults.
And then how long you been practicing medicine?
I have been a doctor for 10 years, and I have been doing direct primary care for a little over 2 years.
You're local here in Indianapolis, where you're
Yep. My practice is at 22nd and Meridian.
22nd and Meridian. Okay, you're near downtown. Okay.
Is
Okay.
your
Gotcha.
is your monthly fee reimbursable to patients through health savings plans?
Through an HSA, you're saying?
Yeah.
Yes, people can use their HSA for that.
Okay. And then is
But
there
I guess the only I'm sorry, I do apologize. Just create so many questions, but I'm looking at you. I said, well, because I'm trying to think how, if in order to not to add so much cost, because when you get your insurance, you get this huge. Here's what your monthly fee is on insurance, but something. How can you reduce that if it come to someone like yourself to be able to take advantage of the insurance instead of paying so much out there? Just trying to think out the box here.
I'm sorry. Can you repeat your question a little bit so I can understand it?
Well, because when you take insurance. Insurance is it depends. It's a PPO plan or HSA plan. One of the three plans, and there's a cost.
Mhm.
The cost could be your total monthly cost could be, if you're a family plan, it could be $400 to $600 a month, or really, or a pay period, really, some cases. And and it's all, and all that primary thing that was built into one, and just try to figure out can we how can you pick a plan that could be more advantageous to someone like yourself?
That would fit with direct primary care. Yeah. I
Right,
understand.
yeah, yeah. So that's what I'm trying to, because the plans are not built for someone like yourself.
Yep. So I have patients of all different types of insurance. I have patients who don't have insurance. I have patients who are small business owners, and so they can't afford health insurance, and so they're part of a health share like MediShare. So I'm able to do a majority of the healthcare needs that they would need, and then they just pay out of pocket for a specialist. And luckily, I've been able to keep them out of urgent care and keep them out of the ER, which if you've ever been to the ER, that insurance didn't cover that, that can be like $2,000. That's, more than what a year with me would be.
Right.
And I have patients who have private health insurance, who often have high deductible plans. So their monthly premiums are a little bit cheaper. And then they just have a saving, like a emergency fund that would cover if they, ended up having to meet what their deductible would be. And they see me, and again, because they can get in to see me a lot more easily than you can in a traditional clinic. I'm able to help manage some of their chronic care problems, like their diabetes, and like get it under control. That way they don't have long-term poor health outcomes than they otherwise would. And then I just have some people who have PPO plans, who are busy professionals who can just never get in to see the doctor because it is honestly cheaper to pay me than it is for them to miss a day of work. Where they miss a day of work, they wait an hour to see the doctor who they get to talk to for 7 minutes. Maybe they got their problems addressed and maybe they didn't. So it's kind of a balance for different people.
So you set up a I guess reoccurring costs every, so you set up for you're billing them every month for your service, whether you see you or not, which is what we pay insurance, whether we see them or not. Okay, I got you.
Yep. But you're paying for actual health care with me. And you're paying to be able to get in to see me because I am running a business and I have certain expenses that I have to meet, and then I have to pay myself above that. We all know that.
Right.
And so because I know how much is coming in every month, because I'm getting paid every month, I don't have to have 3,000 patients on my panel. I can have like 150 patients on my panel. And so when you get a sinus infection or you hurt your ankle or, so on and so forth, you can get in same day to see me. Or, you're also paying for direct access to me. And so maybe you don't see me, but maybe you text me questions periodically.
Do you sign up with a contract for people, or do they just come in and sign up for a month?
A month.
Is it month by month?
Yeah. So everyone has to sign a contract just because of the legal parts of medicine, like on this date, we are starting a physician-patient relationship. But there are certain things that allow a patient or allow me to terminate that agreement using legal terms. And so people can cancel at any time. So I'm not like a used car salesman. I'm not trying to like get people to join for something that they're not actually going to use. And so I tell people, like, if you feel like this model of healthcare is not beneficial to you, then you shouldn't pay money for it, just like you shouldn't pay money for anything that you're not actually using. So people can cancel at any time, but they can't continuously cancel and then come back and then cancel and then come back, because the way that the model works is by me having a panel of patients that are about the same number of patients.
Okay.
So you want reoccurring customers all the month, because really you're in a business to to take care of yourself and your family as well. So I do understand that. So my question is, what's the max capacity for you that you have for your practice?
So every direct primary care doctor will be different. For me, I probably am going to max out at about 120 patients.
Okay. So another question. So are you looking to bring on another doctor like yourself to partners to kind of support, or you just strictly going to be just a one-man band?
Yeah, so I actually have another doctor who is in my practice, but we function essentially separately. Like if you are my patient, you are my patient, and you communicate with me only.
Okay. Okay. Gotcha. Being so very interesting, something to strongly consider.
Mhm.
You know, I mean, I think that's a, you know, this is like, wait a minute, this really exists now.
Mm-hmm.
Yeah,
Yep.
this is pretty cool. This
Yeah.
it's a different concept, but the desirability of that direct access, that convenience, that personal care, really um, is a really strong draw for particular individuals. So,
Yeah,
um,
I really like practicing medicine this way. I would never go back to the old system. And I have had several family members who live here and live in different states who have a direct primary care doctor also.
wonderful. Do we have any other questions for Dr. Holiday?
Well, we can be talk all night on this, but I won't. I won't.
I think so. Well, I want
I,
to.
I guess
but I just continue to go down
the
this
other thing
path.
that I'll say is that unlike another, type of medical practice, I do meet and greets for people. And so if you contact the email or the phone number that I have listed, we can schedule a time to do a 15-minute meet and greet. And I answer questions for people, just like I'm answering questions for you. And people can kind of get to know me a little bit and decide if they like me and want me to be their doctor. Again, as opposed to just being randomly assigned to somebody that you meet 3 months later.
Wonderful. Well, thank you so much for being with us and sharing all of this wonderful information, Dr. Holliday. We always encourage our members to do follow-up one-on-ones as a way to, of course, get to know each other better, build those relationships, find out what other commonalities we may have between our businesses, and just to become comfortable so that we can give those warm, knowledgeable referrals. So I will include your contact information, as I mentioned, when I post this on YouTube and on our Collaborating Connections site. And we'd like to see you again. I think there's a likelihood that we could have more conversation, more questions for you. So if that being said, we are going to move on to our next introductions. And I know, Nancy, you've got to roll off at 7, so I want to give you the opportunity. Nancy, are you ready to introduce yourself and your business?
Yes, I am Nancy Vesley, IHC Specialty Benefits. I'm a local licensed health insurance producer. Going a little crazy today with all the Medicare people that are calling in and saying, hey, can we talk about that Medicare? Yeah, in 24 hours, we'll talk about that Medicare. I also do small businesses, Medicare. Right now, the marketplace is open, so I'm helping people on the marketplace. What else? Dog and cat insurance. Those are the big ones right there. And right now, my brain's a little fried. Look, Robert's showing up now.
Ah,
Hey,
But that's it. And I will connect with you, Rachel. I have a couple possibles because they don't have any insurance. And I have a one dental, which is a lot of it sounds a lot like what you do, but it's with the dental thing because dental insurance is wickedly expensive too. And you pay every month and it's a limited to how much you get for it. But they do a yearly number and then you get their cost savings plans for the whole year. But I will connect with you and we can talk further. But yep, health insurance. That's it.
health insurance, dog and cat insurance. What other types of insurance, Nancy? Is that it?
Yeah, small business. That's about it. That's all I got.
Okay. Are you still doing life?
Oh yeah, life is in there. Yes, you're right. See, you always get one. It's like, yeah, I missed life insurance, which a lot of people don't have it. But if you are a breadwinner to your family, you really should have it Because what happens if you're not there anymore? The bills still come in.
Well, at this time of year when individuals, if they have corporate insurance plans that cover the health, and there's usually some life options in there too. So it's a time that a lot of people are considering the whole shebang of employment benefits. And if they want to be able to make some comparisons, just to know that you are available to discuss those as well, just to give somebody some options. And again, we mentioned that you are a subject matter expert in those areas. So got questions? Call Nancy.
There you go. Thanks.
Oh, thank you. Do we have any questions for Nancy before she has to get off the line? All right. Well, thanks for being with us this evening, Nancy.
Take care. Thank
We'll
you.
look forward to catching up again soon.
Okay. Bye.
Okay. So glad that you were able to join us this evening, Robert. I want to give you the opportunity. So, Robert Hailey, are you ready to introduce yourself and your business?
Yes, I am definitely, sir. Robert Hailey with Old National Bank, Community Development Mortgage Loan Officer, which we speak kind of deal with the low to moderate income folks, trying to help folks that's to create really catch up on the housing wealth that gap that we're experiencing for the low to moderate income folks. So I spend time for trying to educate as well as help them to understand you can be a homeowner. I can bring them to 25 years of experience in the mortgage industry itself, so wealth of knowledge in this field of where I play in, which is my passion is to help folks to be that. So definitely really looking for community partners, any referral partners, anyone that looking to be a homeowner. I do have dollars to help folks to get there too as well. So Robert Hailey, Old National Bank, your community development person.
Awesome. Thanks so much, Robert. Do we have any questions for Robert this evening with Old National Bank and mortgage lending? All right. Robert, I always invite you to share any updates that you've got going on with particular programming or educational programming.
Well, in my time, I'm with the 100 Black Men as well. We do mentoring. We're a mentoring organization. I run our 5th to 9th graders. We're always looking for volunteers as well as funding to help to make a difference for our young people. We deal with this year in my Saturday program. I have 42 young men that's in the program. We do a 4 hours stint with the young people. First hour is mentoring, 2 hours of STEM, and then 1 hour of kind of musical infusion for them. That definitely helped them understand music. Normally it's a health and wealth piece, but I couldn't get a gym this year, so therefore I put the music infusion in there, as well as I'm adding another component to this is a reading lab. It'd be amazing that how many young folks just don't know how to read, and they've been pushed through the system. So our goal is really to help to impact our young people with 4 key goals. One is education, health and wellness, economic empowerment, and most importantly, community engagement. Those are the key things there, because you feel that you want to change a young person, you really got to help them understand that how education plays a part in where they are and where they're going, and how they have to take ownership of themselves where they are. And a lot of folks, instead of just moving down get kicked down the road, but have them to actually take ownership of that. One of my my affirmation help them help you to understand who you are today so you can see your tomorrow. So you can't really make them see tomorrow if they don't understand where they are right now. And economic means that economic is, Indianapolis is Indianapolis is the 52nd poorest city in the United States. So I mean that I tell young people, so I mean that if you don't do nothing to change, chances are you will be where you are, just older. And I can take you out there where we had mentoring. I can take them down there right there to the military park, and that's so you can be one of them, where your Your house is the sky, is your roof, the ground is your level, is your bed, everything else, and everybody, and these walls you see of these buildings is the walls that you have. I mean that everybody can come to your house at any given time they want to, and this is it. And you have no choices. So our goal is to help them understand their options right now today. So that's the key points that help folks to understand that. Because if we don't get them to understand that part, you can't change the mindset of them. And it's also the parents, and I always have parent engagement, which helping parents to understand. So what did you fail your son? If you look at his grade, his report card, and you figure out if he's not a B student, strong A, and he's failing, and if he's not that, and he's failing everything, or he got bad marks, so you failed him. And a lot of times it's not because you wanted to fail them, just because you didn't have the tools or know the tools to get. And now you want to try to fix something, and you still have not fixed all the issues, because I always tell them to say you must, in order to fix him, which I only gonna have for a few hours, you got him all day long, and you got to look at your background, your activities, the people you're hanging out with, things you're doing, to see. So you really got to change those habits in order to your son can change their habits. So really try to impact that way. So I'm passionate about that, passionate about helping our young folks move forward. Then also to introduce them to something to make him start thinking about their tomorrow, their job, school, and I just think the biggest thing that hurting us today is that folks say, well, you don't need a degree to do anything. I said, well, and people have taken that literally. I said, see, that's the problem. You have taken that literally, and you feel like you can just go do what you want. I said, no, you still need education. Some of you all may be able to, if you take 10 of them, so 1 out of 100, maybe 2 out of 100 may able to move forward without going through a structured educational process. The 98 of them need a structured process. Help them, because help think. I said, schooling help you to think critically. I said, yeah, you're not going to be a doctor. You're not going to be a doctor, but you still need to be able to think.
Sure.
You got to still be able to educate, understand. You got to be able to comprehend. You got to still be able to articulate yourself. You got to still be able to walk things through. And I said, you got to remember, problems going to happen no matter where you are. So education is helping you to understand that part. And and in this journey of education, you may learn something, you may grab something that may want to take you may want to learn more about. And there's more paths to go through other than some football or some sport thing or some music thing. So we got to understand you got more on the other side to get there. So we hope people understand that and show them where they need to be. We don't try to kill their dreams, but we also try to make sure they understand they must dream bigger and look for beyond.
Have the well-rounded perspective.
Right. And then we expose them. Then I do a college tour with the kids. I said, because typically people talk about college abstractly. Well, you're going to go to college, but the kid, I said, well, you talking about that, and that kid can't even spell college, in some cases. So I try to take them to do a college tour, put them on the campus, actually see professors, sit in some of the rooms, in some of the lecture halls in class, and then you start talking about college. Now the dots start connecting and showing here and seeing other students that looks like them, been through them, have in school. Some doing very well. Some, hey, I always tell the professors, I don't want the A student. I want the student that's A student. I want the student that's kind of struggling and struggling, so they can see that, hey, I may be struggling, but I'm here and I'm moving forward. And so they can see themselves in both levels.
Who can experience the real progress.
Right. So we try change. So I try to do those things because when you start talking to kids, now I become more real to them. I said, wow, okay. And we're not talking about waiting until you get to 12th grade. We're talking about while you're in 5th grade, 6th grade, 7th grade, 8th grade, 9th grade. That's my group. I'm talking about you now. You're a few years from there, but you got to start thinking about it, and you got to start doing things to make the difference.
Wonderful.
So that's mine.
Well, thank you for your passion and support for the young generation. My quick question for you is, For those who are interested in volunteering or supporting, getting in there right along with you and helping the younger generation, will they contact you at this same information here, or do you have a
Well,
website and
yep,
number?
yep, we can go. You can for volunteering to sign up for. Make sure you understand. We can go. You can go to www.100blackmanindy 100blackmanindy.org. You can go there and go to our website. You can my email, which is rhailey Hailey at 100blackmanindy.org. That is my email as well. As well as you can reach me on my phone, 317-201-4602.
Wonderful.
So definitely so, but again, volunteering and as well as dollars, because these programs that we don't charge the parents for anything. It costs me to run my program for the whole year for all I do. It may cost for everything we do. It'll cost us about $40,000 to get me to for the summer for the year. That's all. That's field trips, shirts, everything, food, everything else, and then all the tools I need to make everything work.
All right. So every little bit counts.
Every dollar, every penny, every dollar counts.
We spoke at the top of the meeting about the To the Rescue, what the rescue stood for, and talked about communities. So whereas we have a desire to support the communities that we live and work in, that our client base comes from, and an organization such as the 100 Black Men of Indy is just one of those community organizations that we love to support and be a part of. So I want to encourage anybody within listening of this recording to check it out and see what a difference they might be able to contribute to. Okay. Any other questions for Robert tonight? All righty.
I gotta jump off because I have a closing. Run to, so I do
Okay.
apologize.
No, but thank you for being with us, Robert.
Yeah. Apologize again. So again, Rachel, fantastic what you do. I gotta figure out how to make this work with you. I think you are a diamond that we all need to see, and we need more of you because we need to take back this healthcare system so we can really give people true care and have a true doctor relationship, not just someone we hey, a 10-minute thing, and you really want somebody to really take time to understand and really help you, not to give you more medicine, but more to get you off the medicine and move you forward. And so I applaud to you what you do. Thank you.
Thank you.
All righty.
Yeah. See you, Dawn.
See you next week, Robert.
Yes. Thank you.
Thank you. Well, Rachel, I'll take this opportunity to introduce myself and my business, Dawn Evans Casey, and my company is Spa Travel. When I started out with TTR Networking, it was probably about 6 years ago, and I was a member of 3 different groups. In the travel industry, I can work anywhere with any clientele. So I was a member of a group on the north side of Indy and central Indy and on the south side. And but I live on the east side, and I mentioned to Jennifer, hey, we don't have a group on the east side. So, the old adage, you never complain about something unless you have a solution. So the solution was that I utilized the best practices of the groups that I had been participating with and started an east side group. And as I mentioned, we were meeting in person at the time, but we've transitioned to this Zoom call, this virtual meeting, which I really enjoy being able to connect with professionals all over, with a very diverse background of industries, and the way that they meet their clients' needs is I've learned so much. So Spa Travel is a home-based travel business for me. My day job, I'm a corporate auditor, but I was traveling quite a bit when I was working for a public accounting company. And a friend of mine suggested, well, if you're traveling all the time, Dawn, why don't you get paid for it? Which sounded like a really good idea. So I found an awesome host agency to work with, completed my training, and have been helping people have enjoyable, memorable travel experiences, less the stress. Because individuals get out there on the internet themselves and do their searches and find where they want to go and how much they want to pay. Ultimately, without knowing all of the vendors everywhere, without knowing all the ins and outs of the industry, they can be stressed out just by the experience. And I want to help my clients resolve some of that stress, get back some of their time by utilizing my skills to listen to what they're looking for and provide them with some proposals based upon their budget, their desires, get them to think about, well, once you get there, what do you want to do? I recommend excursions and tours and great places to eat. And I'm hoping that they not only have a wonderful time, but that they'll want to travel again in the future simply because, they found the experience to be simplistic and enjoyable. Even beyond the booking, I still want to engage with my clients and make sure that, if they have any hiccups, any flight cancellation, their hotel is not quite what they expected, that they have an advocate that's going to be talking to their vendors to straighten out, iron out any of those issues. And the vendors are happy to talk with me and work with me because, of course, they want me to recommend more folks to come their way. So it's a win-win situation for all. I get to use my travel business in my own travel to as I also have interests in family history genealogy. So I've used my travel to go around and meet new family members and do my genealogy research. And it's just been such a joy. So if you happen to know of anybody who's interested in travel, planning a trip going forward, whether it is domestic or abroad, airfare, hotel, all-inclusive resort, destination rail, cruises, all of the above, I'm happy to help. So again, my name is Dawn Evans Casey, and the company is Spa Travel.
Do you do more domestic trips or more international? Obviously, 2020 put a huge kink in your business.
Oh, yes.
Curious.
Oh,
And
yes.
I know that people are traveling more international now, so I don't know.
There are still places that may have concerns, and I stay on top of that based upon information that's available on the internet. So I can tell individuals, where they're having any outbreaks, what's safe, any civil unrest going on that they should avoid. But a lot of people are becoming much more comfortable with traveling domestically. Whether even car rentals is within my travel realm that I help with. A lot of people are driving themselves, and then finding accommodations to go on their domestic trips. But if they're flying, I keep them abreast of what are the requirements to make sure that they can get around safely and get back home. So yeah, the international travel is starting to climb once again. You had a lot of people post-COVID who were just ready to go somewhere. So I'm happy to assist.
Where are the hot spots going to be for 2023? Where are people traveling to?
A lot of people are still like those Caribbean destinations. As we're getting into the cold weather, being in the Midwest right now, people are looking forward to going where they can get some sunshine, get that vitamin D, lay on a beach, and see the beauty and warmth. So that's a lot of it right now. Um, a lot of people are traveling for the holidays, even, but airline prices have been going up. So it's something to watch. We'll see if in the long run, I know prices at the gas station are starting to come down this month, and we'll see if perhaps that trickles to the airlines, if their costs in perhaps early 2023 will start to come down again. But it's something to watch. Um, Travel is certainly something that should be planned for. When you can get the last minute deals, that's great. But usually when you wait to the last minute, you're sacrificing, your options are limited, and you're always sacrificing something. So if you've got that type of flexibility, it's wonderful. But if you'd like the predictability and the options, it's best to plan ahead. And the sweet spot is generally to do your purchase 7 to 8 weeks ahead of a flight time.
Is that the case with international flights too?
With international flights, and what I've been seeing is timing will fluctuate over, airlines will adjust flight times as well. So you always have to build in a cushion. For international flights, I'd say 2 months ahead is still a good time to plan. If you have more time, it's good to take more time.
Mhm. Good to plan even before 2 months ahead.
Yes, definitely.
Okay.
Definitely.
Okay. Cool.
Okay. Well, we're at 7:15, and we usually go 60 to 90 minutes with our meetings. I know I mentioned that the theme for this month is December digging into the details. So I've got some information about business metrics, and I think what I'll do so that the majority of folks get the useful information is just to share initially what the business metrics are about, and why they're good to track and how they can help our business. But the entire article, I'll share it on our Collaborating Connections Facebook page for those who want to take the time to read and get into the details. Okay. So just to update, business metrics are quantifiable measures used to track business procedures to judge the performance level of our business. And there's hundreds of metrics because there's so many different types of businesses with a lot of different processes. So the bigger businesses, the big corporate businesses, are usually very fluent in business metrics. For the smaller mom and pop businesses, business metrics are probably a less familiar term and not tracked as meticulously, but they're still important. So the benefits of tracking business metrics are managing operations based on the results, maximizing business chances for success, and it's just that simple. And hard at the same time, depending on your resources, such as time and how you gather those details. So the 6 key benefits in tracking business metrics are performance improvement, comparative analysis, knowing where we are in line with our competition and with the norms of our industry, alignment, where business metrics can be used to ensure that the entire company is working towards shared organizational goals, compliance, if you happen to be in an industry that is regulated, the business metrics can be used to track your compliance with those related regulations. Communication. Reporting business metrics is a vital communication tool for customers, shareholders, employees, and society at large. So oftentimes we can communicate about the productivity or the quality of our company by sharing metric information in our marketing. And business metrics can be used to identify problems. So as we analyze our business metrics, it helps identify emerging problems in time to correct them before they become major pain points. And included in the article is what you can do, because business metrics, as I mentioned, there's so many of them, so difficult to choose from. There's a guide of about, let's see, 4 or 5 topics on how we can choose the business metrics that are best for our company, our industry, our type of business. So I will leave that and the top 35 key business metrics to track in the coming year. That detail is in the article. And for anybody interested, they can go ahead and access that article from our Collaborating Connections website. And we'll be talking more about that in our next meeting, next Tuesday evening. Anything that you'd like to share about business metrics or on that topic before you go, Rachel?
Nothing that I can think of.
Okay, no problem. Well, as we mentioned earlier, it really has been a joy talking with you this evening. I really appreciate your coming on and sharing with us all about your business and what you are doing in the area of pediatric care, primary care, and being this different kind of doctor in our area. So I'll look forward to following up with you and getting a little bit more information, perhaps, so that I can effectively share what you and your business are about with others.
Yeah. You triggered something in my brain that I just would like to share in general.
Sure.
So when I used to work for another company and I was just, a name, and I really wanted to leave, one of the things that kept me there for a while was lack of health insurance. Because I said, if I leave this company that's paying for my health insurance, how can I be a small business owner? Like, what happens if I get cancer or get in a car accident or fill in the blank? And so it's been a very interesting journey understanding in medical school how to diagnose and treat diseases. But then on the flip side of that, now understanding how the healthcare system and how health insurance works. I am happy to talk to anybody who is kind of struggling with this area that is being kept from being a small business owner with this healthcare piece. I do have more connections that I didn't quite get into just because of time that I can connect people with.
Wow, that's great. Well, we will look forward to hearing more about that.
Yeah. Thank you
so much. Go forward and have a wonderfully productive week. And we'd like to invite you back to visit with us again sometime.
Yeah, thank you.
Okay, take care.
Bye.
Bye-bye.